Well, good evening, everyone, and welcome to Salem Speaks. This is a new program. It's an initiative of the Salem Union Baptist Church on Taylor Street, Nassau, Bahamas. This is our initial program, and I'd like to introduce, for the first time, they are making history this afternoon. Our first two guests on Salem Speaks is Mrs. Charmaine Sinclair. She is the Assistant Director of Education. Let me get all of her profile right. Planning and Research Section, the Ministry of Education, Department of Education. Welcome, Mrs. Sinclair.
Thank you, sir. Good evening to all.
And secondly, on our program this evening, we want to welcome Dr. Philip Swan. He is the Registrar at the Ministry of Health. I know he might have some other titles, but I don't happen to know all of them. But Dr. Swan, welcome to Salem Speaks.
Thank you, Reverend.
First of all, before we get into the program, I just want you to know that this is an interactive program. So we want you to please take advantage of our platforms and just send your questions. Just write your questions in. We will be happy to answer them all as best as we possibly can. So please remember that. Have your questions as we make our presentation, and when you send them in, we will do our best to answer all of your questions. This program that we are going to begin with this evening is one that we thought was that important that we made it priority: education and the return of our students back to school. And for those of you who might not know, our church, I just wanted to put this in, but our church is a church that has notable educators who are part of this church. You would recall Dr. Carlton Francis, Reverend Carlton Francis. He was one of the first ministers in the Progressive Liberal Party government many years when they came under majority rule, Carlton Francis. And we have a school that is named after him, a veteran educator. And then our pastor emeritus of this church. These were giants in the education department over many, many years. Many persons would have come through both of those men's hands, and they are now educators today, or they would have passed through the educational system. Many principals are part of Salem Union Baptist Church. I'm not going to get into, because I could probably be naming for quite a while. But what I wanted to say was that we have many products. So our history is steeped in education. Now, COVID-19, because we are talking about this particular season that we are in, and COVID-19 has affected basically every country around the world. Many governments have been, over the past 7, 8, or 9 months, they have been scrambling to see how they can deal with this pandemic, economic-wise, socially-wise, and health-wise. So many issues that has affected many, many nations, and I would say negatively. But there is one underlying effect that sometimes might not get the kind of highlight as it should, and that would be the education of our children. Because you see, all of them go hand in hand. When parents can't go to work, they're home with their kids, or the kids are home, and for the parents to go back to work, the kids need to be to school. There is that synergy between all of them. So that's why we want to really look at it today to see how we can really focus on getting some answers as to our children going back to school. If children can't go to school, parents have difficulty going to work, economic situations decrease, so on and so forth. And so it is for that reason that we want to speak to you today on this issue. Now, there was a time when epidemiologists were saying about children that they don't particularly get affected by this pandemic. Very low rate of children catching this disease. But we've recognized a little later on into it now that children are susceptible to catching this virus, and some of them have even died. So with that in mind, we want to really look carefully and discuss this evening how children can safely go back to school. How do we balance the educational concerns along with the health concerns that we have as parents, as guardians, and teachers at schools? And so I'm going to ask Sister Charmaine if she would respond to that. How are you balancing the health concerns along with educational requirements? And then we'll go over to Dr. Swan.
All right, so we have adopted a motto at the Ministry of Education in this particular era. Safety first, education always. And we are guided by the public health officials with whatever we're going to implement for the reopening of schools for 2020.
Yes.
We have a continued partnership with the Ministry of Health. We are always cognizant of the fact that we are the educators, but they are the technical experts in the field of health. And so we have developed a plan guided by officials of the Ministry of Health. The plan is to begin school in a few islands in the remote model. Those islands that have a low count or low cases of positive COVID-19 cases, they would begin with the face-to-face, but they will practice all of the health and safety protocols that have been mandated by the Ministry of Health. There is a third model that we have created, not just the remote or virtual and not just the face-to-face, but what we call a hybrid blended learning model. And this model would allow a small amount or specific grade levels to be on campus while other grade levels are in the virtual space being schooled. So all of these things coming together, guided by Ministry of Health, knowing that education must continue, we are going to begin school.
Yeah, so thank you, Sister Charmaine. Could you say specifically the date again when schools are scheduled to open?
Yeah, so the Minister of Health the Minister of Education has already announced that public schools begin October the 5th, 2020, with some schools, the schools on 4 islands in particular, at this particular time, we can say New Providence, Bimini, Eleuthera Mainland, and Abaco will begin in the virtual or remote learning space.
Okay.
Yes, the others, face-to-face, as far as we're aware now. If the public health officials say that we need to make that change, then they will either go to the virtual, the other islands, or the blended hybrid learning model will be implemented.
Right, so all government schools are scheduled to
5th.
Open on October the 5th. Is
Yes.
that a Monday?
That's a Monday,
It's a
sir.
Monday, October 5th. Thank you very much, Sister Charmaine.
Yes.
And Dr. Swan, in that same vein, parents are concerned about children going back to school. And then Sister Charmaine, I think she just mentioned that particularly in 4 areas in New Providence, and Bimini and Eleuthera and Abaco, they will not actually be in person
campus,
on
yes.
campus. But teachers will be on campus.
Yes.
And I believe we listen to the news, so we hear various concerns coming forth with respect to teachers having to go to a building physically, or they might have to go to their offices where they might be running into people. How safe is it for them to go back to school to actually do these virtual classes for persons? What kind of protocols were done for them to make them feel comfortable to go back to school?
Well, specifically, what the Department of Ministry of Education would have done for their particular schools, I'll have to ask Mrs. Sinclair to speak to. But the general recommendations are the same recommendations that has been floating since March, which is physical distancing and infection prevention control. So control measures rather. So physical distancing, meaning that try to have at least 6 feet between you and the other person. Infection prevention control, of course, would be using, if I go back to physical distancing, making sure that you don't have too many bodies in the building at the same time, because we exist in the era of asymptomatic carriers, so we want to make sure that there is physical distancing that you can enforce, and you also make sure that the space is not crowded, so that you inadvertently invade the space or the surroundings of someone else. And infection prevention control measures would be the sanitizing of your hands before you or as you enter a room, the wearing of a mask over the nose and the mouth, especially when you're interacting with persons. And again, because you don't know when you're going to bump into someone, it's always good to have that mask on, because you may infect someone if you're asymptomatic, as well as you may be infected by another person. And then the other component, of course, would be physical distancing, not touching anyone, so that you don't share commonly used items. We try to get you to bring your own wherever, as far as possible, and then the constant cleaning of high-touch areas. So doorknobs, door handles, rails, especially in schools, and desktops to be confined to use for one individual.
Okay. And so for those 4 islands that I mentioned, New Providence, Bimini, Eleuthera, and Abaco, for now, these areas would only be traversed by teachers and other administrators. Yes.
The cleaning.
It's also important for those teachers and administrators to also engage in those same practices. Because again, they are going into various other circumstances, and you want to make sure that they are not bringing it into their work environment or taking to their respective homes any sources of infection.
Okay, wonderful. So here it is, my dear audience. What Dr. Swan is saying is that the protocols are the protocols, and they are for anywhere and any department in this country, even your home, the same thing we do at church. The protocol is the protocol. You need to sanitize, wear a mask, and what the other one is? Physical distancing. So physical distancing, wearing of your mask, continuous cleaning of the hands. All right. Now, maybe Sister, I don't know if you can answer this, Sister Jan, but let me ask you: when that means that are there any other protocols that the ministry is putting into place with respect to probably the training, I don't know, of the janitresses or janitors to keep these areas sanitized? Do you know what any?
Yes, so we have had a myriad of training sessions, not just for janitresses, but all of our key stakeholders in education. We would have started the training of the persons who clean and maintain the grounds as well as the compounds of our schools' campuses. That training would have taken place not just in the face-to-face with the physical distancing in place, but also in the virtual, because we have schools on many of our islands, and 169 public schools in total. We would have hired a company that would have also engaged our persons who clean in demonstrations of how to clean, what products they should be using. And we also have, as school begins to open, an operations plan for the safe entering of a campus. So taking the temperatures, ensuring that persons go directly to their classes if they're in the face-to-face model, ensuring that for the staff there is a digital sign-in rather than signing a book and touching papers or surfaces. Those kinds of things we would have put in place and are planning for implementation on October the 5th.
Okay, thank you very much, gentlemen. Before we leave this segment, Doctor, I want to ask you, a question concerning COVID. One of the things that we are told is, if you're going to go to any place where you are around other persons, what might be, because a lot of persons still do this, what might be some of the symptoms that people ought to look for to say, well, you know something, I shouldn't go to school today, or I shouldn't participate in this because I'm not particularly sure that, you know, something might not be going wrong with me. We understand that a lot of persons are asymptomatic, but what about the person who, you know, they're feeling, somebody say, oh, I think my throat just a little scratchy, or I think I could still go, or whatever. What are some of those symptoms they ought to look for before they say, you know, I'm going to go to school today?
Right, and heading back to school is going to be a challenge, and also going to be something that persons feel excited to do, especially children, and in some cases teachers, to get back into the work field, to do what it is that they love to do, and to interact and to provide the craft that they have been trained to do. So the symptoms that you speak to, the common symptoms, of course, are fever, runny nose, cough, dry or productive, sore throat. If you have a headache, if you find yourself sneezing uncontrollably, if you find yourself also, if you have any loss of taste or smell, and then if you're starting to have diarrhea or loose stools, vomiting, it's things that you can't pinpoint to something that you would have eaten prior that would have caused these symptoms. We suggest that you stay home and watch it. Don't go out and watch it. Stay home and watch it, because you want to make sure that you are not carrying or infecting anyone else in the community.
Okay, thank you very much. All right, let me move into another segment here. This one caught me a little bit by surprise as a shaman. I really didn't notice, but a particular day I was listening to to an address by the Minister of Education. I can't remember whether it was Parliament or whether it was a particular address. And he was speaking to who is responsible for a child's education. And to my surprise, you know, because I always looked at it as the government, but he said something different. Sister Shamin, could you tell us who is responsible for a child's education, the parents or the government? And then what role is the government responsible for in that process as the regulators of education?
So that's a very good question. We are governed in the Bahamas by an Education Act. The Education Act plainly gives responsibility to parents to ensure that their children are participating in, taking advantage of the educational opportunities provided in the country. The Ministry of Education provides the access to equitable education, a quality education. We are supposed to ensure that all children of compulsory school age will have access to educational opportunities, but parents are responsible by law to ensure that their children participate in, take advantage of the opportunities being provided by the government of the Bahamas.
Okay, and let me get it clear again that parents, you are responsible for your child's education. You are to see to it that they are where they are supposed to be when they are of school going age.
Yes.
That's what it.
Yes.
Now I also heard this, and so I heard this. I think it was the ministry, either the minister or from someone in the ministry, that some people do homeschooling.
Yes.
So a parent can decide that I want to teach my own child in their own space. And I think what was happening was some people were teaching more than they are wanting or desirous of teaching more than their child, and actually asking a price for it. So what is the Ministry of Education's role then in terms of, number one, can I teach my own child, and can I invite others to come along with me?
So because the Education Act gives the responsibility to parents for educating their children, parents do have that right to homeschool their children. And homeschooling in the Bahamas, we kind of get the definition a little bit confused. What you mentioned in terms of some people coming together, 4 or 5 children in a home being taught by someone who is other than the parent, is what is really called a home-based school, not homeschooling. Homeschooling is you as a parent can decide that I want to educate my child at home. You are the principal facilitator of the learning in the home. That's homeschooling. And a home-based school may be those persons who decide that they are qualified, they have the necessary curricular activities and wherewithal to be able to educate a few children. And so that would be a home-based school, and they would have to register with the Ministry of Education through our National Accreditation and Equivalency Council, NACOB we call it, and they pay attention to the quality of the education. We also have a homeschooling unit where parents are encouraged to register if they are going to homeschool their children.
Okay, thank you. And then Dr. Swan, for someone who wants to do what Mrs. Sinclair just mentioned about home-based schooling, what would you say to those persons? Because the Ministry of Education is not allowing in-person or face-to-face teaching at this time in New Providence, Abaco, Eleuthera, and Bimini. What would you say to a parent who is desirous of doing that with respect to health concerns in their homes?
So the Ministry of Education, or I should say the Department of Education, in its schools in New Providence, Bimini, Abaco, and Eleuthera, are having virtual schools starting in October.
Right.
However, it is allowing private schools to have in-person schooling experiences once they adhere to certain recommendations and requirements, and that would be physical distancing and the decreased number of students in each classroom, and of course the student-to-teacher ratio, and various implements such as the hand sanitizing stations, just protocols that the school has committed to adhering to while their school is in session. So this is one of the challenges that even us in the Ministry of Health have been trying to appreciate the various nuances when it comes to regulating education in the country. Department of Education manages the public school system. The Ministry of Education has the mandate for setting the protocols, the policies for all schools. And so we have to ensure that as the minister speaks, he sometimes speaks solely on behalf of the Department of Education, but his general mandate, is, of course, is the control of all schools on island. And I say that because there are schools that open on Monday, And then some that start again on the 14th and 21st, depending on the ability of them to ensure the safety of children and students and teachers rather than other staff members within that school setting. And I have to go back to the question you asked me a few moments ago about symptomatology. That checklist is a checklist that you should check every morning before you leave home with your child. So if your child or someone in the home has any of those symptoms, keep that child home for that day and reach out to the school and let them know what's going on. They would appreciate that more than you taking the child and the child becoming sick during the course of the day. And that's not just in the school setting, as I mentioned. It is for you if you're going to work.
Right.
The same thing you should follow.
Right. The question I have too about children's symptoms, do they demonstrate those same symptoms as adults?
For the most part, they do. Yes,
Okay.
for the most part, they do. And so it's very important for you to understand your child, because when some of us have special needs children, and we need to figure out if our child is going into a school, a physical face-to-face session, how do you interpret that child's symptomatology to that represents what it is that you're keeping an eye out for.
Right. Okay. Thank you very much. Sister Charmaine. The reason I call her Sister Charmaine sometimes, and Mrs. Sinclair sometimes, because she is a member of the church here at Salem. I am a parent, and I am getting ready now to go back to work. My child or my children are at home, the four places, right, that are not having face-to-face schooling as yet. I cannot drop my child off to a school. Is there any measures put in place for my child to receive an education? Because it is virtual. I'm going to work. They are not grown enough to actually pick up an iPad or a computer to actually complete any work. What has been put in place, if any, for my child, because I have no idea what I am going to do and how they will be educated virtually. What answer could you give to me, please?
All right, so that's one of the tough questions. That's one of the challenges. Because I would have mentioned earlier that it is the responsibility of the parent to ensure that the child accesses or participates in the educational opportunities. School is, for many people, many children, a safe haven. It is a place where, as you mentioned, parents would drop a child off as early as 7 a.m. in the morning, and they don't worry about their child anymore until the end of the day.
Right.
And so it is a real struggle for some persons. Now, this is where the community comes in. This is where the church comes in. This is where family comes in as well. And then parents have to do some stock taking. Ministry of Education has been trying to partner with organizations. Some actual churches have stepped forward to say that they would be what we call care centers, where parents can take their children. There will be someone who is there, not necessarily an educator, but someone who is responsible, who can ensure that that child sits with their device, they are attending the classes as the teachers are teaching in the virtual. It's not an easy solution. It presents several challenges. And then we as a people in the Bahamas have often overlooked some vulnerable groups. So Dr. Swan would have mentioned our children with special needs. We say in New Providence that we will be in the virtual, but there are some of our special needs children who will not be able to take advantage of learning in the virtual. So for them, we have to make allowances for them to actually go on campus and be face-to-face with their teachers. There are some groups with certain disabilities. If you think about the visually impaired and the hearing impaired, how do we teach them in the virtual? So we have to make adjustments. We have to adapt. We have to use assistive devices. Right. But coming back to parents now having to plan, right, organize, who is going to be at home with my child? Is there somewhere safe that I can take that child? I had a conversation with someone last night who is unemployed. Right. And she said, you know, I think I have skills. I think I am responsible enough. Do you think I can register with the Ministry of Education as a home-based school and have 5 children in my home where they are in the virtual, they're still being taught because Ministry of Education has made that allowance. Right. Even our homeschooled children can access our virtual schooling network. Right. Those persons who are doing the home-based schools will be responsible for the assessment of the assignments and everything, but they're still able to catch our live classes or classes on demand and pull from the resources that we have online. So even in terms of networking and connecting with people who may be able to accommodate 3 children, 5 children. Right. And yes, you may have to pay them.
Yes.
Yes.
Okay. Yeah, what I see, you know, let me just interject here because I asked that question because this is not going to be an easy situation that we are dealing with. And we are going to have to be our brother's keeper. We're going to have to, particularly now, I'm going to talk to the church in particular because this gives the church, and I'm not talking about a building now, right, I'm talking about people, right, the opportunity to be a blessing to your neighbor. For some of you, your children are grown, and so on and so forth. They're out of the house. Here is an opportunity for you to be able to be a blessing to somebody else. Children are going to need a whole lot of stuff. I'm going to get to it in a minute. But I want the church and those who are community-minded to take this as an opportunity, not only to give them education that they would get in school, but to give them some other kinds of education.
Yes.
Some of them don't know what it is to have a mother or a father to care for them. This is your time. I thought I'd put that in right there to say that, listen, these trials that are coming to the little ones in our nation are opportunities for us to be able to extend a hand to these people. Now, in doing that, I understand because I'm going to get to one more question with Sister Charmaine, and then I'm going to go across the dock again, because here is a challenge now. Parents are beginning to find out. We just talked about what kind of support we can have. But parents, those parents who are at home, they are beginning to really appreciate a teacher and how their teacher is able to handle their child.
Yes.
I've been listening to some of the comments that have been made because parents are saying to teachers, please come get your child. It's their child, you know. But they are appreciating how difficult it is to transfer knowledge. Some people, Sister Charmaine, are frustrated. They don't know what to do. I've seen this personally now, where they are trying to get little children to sit down and stay to a device, and they are not obeying in that house. They cannot get that house to turn into a learning environment. What can you say to a parent like that who is really trying?
Yes.
But they can't seem to get their child to be able to do that work online. They're frustrated. What could you say to them, Sister Shaman? That frustrated guardian or parent, grandparent?
Yeah. So there are several things. One, you have support. The Ministry of Education has already determined that in our plan of action, we need to be able to give support to parents by providing them with tips as to how to deal with a child who just may not be attending for any length of time.
Right.
We also want to say that not all learning takes place in a school environment.
Right.
You as a parent have some skills that you may not even be thinking of. So when that child is tired of sitting in front of the device or tired of sitting and writing out whatever the assignment is, there are some other lessons that they can learn. You can actually pull them away from what they're doing and teach them how to make bread. Talk to them about your kinds of life experiences and what kinds of lessons you would have learned. So they're away from that. I have to sit in front of this device. I have to write this out. I have to type this out. So that's a break that you can give them. But also call upon the support and the network that you may have as well. Yes, we as the church, we are here to, sometimes you just need to take a breath and get away from the child for a few minutes.
Yes.
Teachers don't have that luxury all the time, but we do have break and lunch periods, eh?
Right.
But the same way that we have that break and lunch period, you have to also recognize as a parent that you can also take a break. You don't need to feel guilty about it.
Right.
You give them something to do other than the work of the school work, and you take that time as a break.
Okay. And does the ministry give like schedules, like guidelines of how long should they be as a parent? So do the parents get, okay, how long should I try to keep a session, and then what should I do do they get all of that to help them along?
So we have several things. We have the tips. We have videos that we've already provided, but it also depends on the developmental stage of your child. A preschool child may not be able to attend as long as a high school child. So know the difference, and yes, we are providing guidelines for that as well. And then there are also on the website, the Ministry of Education's website, besides the videos, there is also a support, an online support where you can send a message, send an email. So we have a special email, school reopening, Ministry of Education, schoolreopening.com, and you send that email. But you could just go to the Ministry of Education's website, and you will find where you can click. We're also establishing a hotline.
Right.
So persons can call in,
Right.
talk with a guidance counselor, talk with someone in a particular area where you're just frustrated, you don't know what to do. Please give me some help.
Okay,
Yes.
Thank you. Dr. Swan, I'll throw this to you. For, let's say a child is participating in the classroom, they are not exhibiting any of those symptoms that you mentioned. But something that the parent recognizes in them, they're probably showing other signs. Are there other signs other than the epidemiology that you can actually, the vomiting or those other ones, that you can say, hey, listen, something might be wrong with my child and I need them to see a doctor?
Right, so one of the things that we have, and as we echo this from the Education Act, you are the primary care provider, you are the primary caregiver for your child. Whether it be health, nutrition, education, you are the primary provider. So that means that at some point in time, you should have taken the time out to know your child. And so if you are seeing anything in your child that is not like him or her, use that as an opportunity to reach out to a healthcare provider to see if there's something that you need to be concerned about. And this is why it's important as well for each family or even each child and each individual to have a primary caregiver that they use as their personal physician or healthcare provider, so that even that individual knows what your child or you are usually like. And when you start to give examples of what it is that you're feeling, there's something is not right, you can take it to another step to see what is going on. So some of the symptoms, as I mentioned earlier, are the more common ones, but there are other uncommon symptoms such as listlessness, drowsiness, sleepiness that can be signs of COVID-19.
Yeah, and you know, in the Bahamas, in terms of discipline, sometimes we don't take the time to know our children that well. The first thing we go to is corporal.
Correct. That's the first thing we.
Y'all know what I'm talking about. If you don't do this, get here. And so that's why I'm asking the question, because parents need, and listen, parents, all of us need to do this. Take a deep breath. COVID has given us an opportunity while we have time. These isolation times should be used or should have been used as opportunities to get to know that stranger in your house. And these times would help you to be able to understand some things about your child, so that when things go wrong, that the first thing you don't do is to raise your hand, but to say, I wonder what's going on with my child, and check and see what's happening in other areas. Let's move to another area, Sister Charmaine. In order to be able to participate in virtual school, you need a device.
Yes.
How is the ministry ensuring, or is the ministry ensuring, that every person that is a participant in the virtual school, that they have a device, and there's no need or no use in having a device if they have no connectivity to the virtual school via internet? What is the ministry's plan in that vein?
Right. So even before COVID-19, the ministry has had several priority areas that we've been working on. And one of those priority areas would be the area of digitization, not just at the Ministry of Education's level, but the government of the Bahamas nationally. This is one of the priorities. Through the Ministry of Education, we would have embarked on a program where we're ensuring that, first of all, our schools have high-speed internet connectivity, and trying to implement Wi-Fi across every campus. So in this way, the teachers now are able to go to campus and they're able to teach in the virtual with the connectivity that they need to have. And those schools that are still not ready, because we would have been stopped by COVID, persons would not have been able to go out from the service providers' offices to do what they needed to do, we still have hardwire. So you connect with your Ethernet cable, all right? For our students, we had also started giving devices on every school's campus, as well as the teachers. But the government of the Bahamas had not been doing it alone. And other organizations had stepped in, and they were giving to teachers, they were giving to students, organizations. We've really been pulling together as a country, civic groups, persons coming from outside of the country. So now, persons would have access to devices in pockets or in particular areas. Not sufficient, though. And so what the government of the Bahamas decided, we need to bring in some more devices. In the US, they're saying that they have a shortage as well, because they are all going into the virtual. And so working with service providers and vendors here locally, and saying to them, now, you know, this is a hard time economically. We need to partner with you. Let's negotiate so that we can have some packages that are low cost, that
Right.
persons will be able to pay minimal amounts so that they can get the devices, they can get the connectivity that they need. But nationally, we also need to pay attention because persons would say, well, in my area, what about electricity? What about power?
Yes, I was about to mention
You
that.
say Abaco is going to be virtual, and
Yes.
we were hit by Dorian.
Yes.
So what's going to happen there? And so you would have noticed, even on the news last night, I noticed that one of the ministers from Grand Bahama would have indicated that he had an organization that was partnering to give devices to students. But we've also had international help, and so organizations like ADRA, which is an Adventist group, organizations through the OAS would have given us devices for particular areas like Abaco,
Yes. Other corporate
other corporate citizens. And so solar power is a part of the plan for the devices for islands like Abaco, where they would have been hit.
Right.
So they're able to power up their devices that have been donated
Yes.
and use the solar power for that. Those kinds of initiatives.
Okay. Another question I wanted to ask concerning that was, are parents required still, even though you are part of the virtual school, what about the norm that I'm used to, the regular? Do they still have to go out and purchase like textbooks, and are they still required to do that as well?
So that's an excellent question, because we got that question about textbooks and uniforms.
And uniforms,
And
yes.
uniforms.
Yes, workbooks. Are they
Right.
still required to do all of this?
So the Minister of Education himself would have made that announcement. Parents, rather than focusing on textbooks this school year, let's focus on purchasing or obtaining those devices. What Ministry of Education is committed to doing is making sure in a learning management system that we're implementing, the content is there that would have normally been part of textbooks. Now, we can't plagiarize and we can't copy the people's books. We would need to purchase licenses for textbooks. But creating content, putting content together so that our students would still be able to access the body of knowledge that they would have gotten through various textbooks. Our concentration, our focus is there. So yes, in some instances, To Kill a Mockingbird, you may not be able to get that in the content in the learning management system. The skills are there that you would need. All of the areas that you would normally pay attention to in literature, but you still have to read the book. To Kill a Mockingbird, A Boy Called Cow, those kinds of things. So the focus is not on the textbooks this year, but rather than getting the digital devices, we are focusing on creating content, developing content, using what we call in education, open education resources. Books, published documents that are of Creative Commons, that is an open space, so we can use those as well.
Okay, back to, I just need to go back to a question. A question came in from one of our listeners. And we mentioned, let me see if I can get us to clarify it. So we mentioned 4 islands that are doing virtual classes only. What about, I think they just want some more clarity. What about all other islands operating face-to-face in all other school and all ages?
Right. So yes, that needs to be clarified. I mentioned our special needs populations, where it may not be feasible or the best quality of education to be delivered in the virtual for those persons, even here on New Providence. So we've made provisions face to face. Those islands that I said would all be face to face. Now, with the social protocols, with the guidance of health, because that could change at any time, and that is why we developed 3 different models. So in those those islands that I named for the virtual, Eleuthera was questioned because they don't have many cases of COVID at this time. But the physical spacing in the schools would have been an issue. So from island to island, we look at the conditions on the ground in terms of what's possible for physical spacing, what's possible in terms of the human resource that's on the ground. Right now, we have determined that at all of the levels on those other islands, we are able to do the face-to-face. But before October 5th, health may say to us, now look here, these cases spiking again, everybody in virtual.
Let me ask, please, I'm going to ask my audience to forgive me ahead of time, but I'm just going to use, for example, just because it's the island of my birth. So please don't harm me for it. So let me use the example of is it still Ellen Coakley?
Yes, it's still Ellen Coakley.
So let's use Ellen Coakley in Exuma.
Yes.
Are they going to have face-to-face classes?
At this time, they will have face-to-face. Their student population is such that, and the campus is such, that they are able to physically distance. Now, the district superintendent there may advise, we thought that we had a full complement of teaching staff, but some of them are now presenting with their letters for comorbidities. They can't be on campus. So what we'll do is we'll switch to the hybrid, where you will have grade 7 and grades 9 on campus on Monday and Wednesday. Grades 10 and 12 on campus on Tuesday and Thursday. And then Friday, no one is on campus because what we'll do is have enrichment activities. That's a possibility. Based on, as I said, the conditions on the ground, the human resource available, and then the physical distance.
I think just to be clear, she mentioned 4 grades, but she was just giving an example.
That's an example, yes.
That's an example. You're not saying at grades 11 and grade 8 wouldn't have any classes.
That was just an example. So we would have either 3 days on campus or 2 days on campus. For each of the grade levels, they would do it alternatively. So some are in the virtual, some are on campus. They're attending school every day, but some are in the virtual, and some are face-to-face.
Okay, so what we'll do, let's not assume that everybody understands then what hybrid means. So explain those 3.
Good question.
Hybrid, face-to-face, and virtual.
Thank you for that, Pastor. Yes, you reminded me to be an educator. So face-to-face is where we have the entire student population on campus for all of their classes. The remote or virtual, that's the same thing, is where they are using their technology. There is no student on campus at all. They are learning in the virtual space, remotely. It's even possible for learning packages to be made available at the school. People just come and pick up their package, go home, and they are having their lessons at home. That's the remote. The hybrid is the blending now of the face-to-face and the remote. So you have some people who would be face-to-face for certain days, and some people who are in the virtual or remote learning space for certain days.
Let me don't say if this is an obvious question, but I'm thinking it is obvious that face-to-face is the best mode of learning.
It is the desired model. Student engagement, you are able to actually interact physically. If not even just touching, you are in that place with the person who's facilitating your learning. You're able to see the expressions clearly. You're able to move about your classroom for various learning centers and activities. That's the desired. But there is still benefit in the virtual or in the remote. Even if, let's say the 3 of us are teachers, and something happens to Dr. Swan, in the virtual space, the two of us can still carry on, even though his class now does not have him as the teacher.
Right.
We can still add them to our
Right.
classes in the virtual. The room is not overcrowded.
Right.
We're still delivering quality education.
Yes.
So benefits in that way.
Yes, I can attest to that because I do have a friend who lives on another island, and they are able to join virtual classes. I'm talking about before COVID.
Okay, yes.
They were
yes.
able to join virtual classes because, as you would know, in some of the islands, they don't have all of the teachers to teach various subjects.
Yes.
So they can join the virtual school
Yes.
from right where they are.
Yes.
We just have a few minutes left, and I just want to throw in one more for the parent. What about the parent? Because we assume many times that parents, because what they do is they take advantage of their cell phones to do all other stuff other than, in some instances, what would be good for their children. What about the parent who is computer challenged and they now have to work with their child? Do you offer anything to assist that parent who is computer challenged, I would say?
Yes. So I would have mentioned the Ministry of Education's website and videos that have been created. That's a challenge in terms of, so what happens? How can I click onto that website to access the video because I am not so technologically savvy?
Right.
What we are going to do is send out even over the radio, on television, in print through the newspapers. These are hotlines that you could call. Someone can walk you through the steps.
Okay.
You mentioned that we had virtual schooling even before COVID.
Yes.
And Ministry of Education is proud to say that we had actually started virtual schooling in the last school year before COVID came into being.
Right.
And one of the benefits of starting that was we had an established hotline, and people were calling to say, you know, you all say you're teaching this child. I don't understand, so somebody needs to walk me through this,
Right.
which is what we did. We have dedicated persons who are willing to do that for you.
Okay, thank you very much.
Yes.
Thank you very much. My brothers and sisters, ladies and gentlemen, we have come to the end. An hour has gone by just like that. And we have come to the end now of our first forum, Salem Speaks. And I am indeed grateful to Mrs. Charmaine Sinclair and to Dr. Swan for joining us this evening on our first program. Please join us again next week, Thursday, at the same time. We are going to continue in this discussion. If you did not get to ask the question that you might have wanted to ask, think about it, have some prepared. We're going to go into some other areas as to how we can help to ensure that every student has a device, how we can ensure that they can have connectivity. We're going to be able to share some more information with you next week. But for now, for my guest, Sister Charmaine Sinclair, Dr. Philip Swan, good evening and God bless you.